Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope you're doing well. Listen, it's October 1st, and what is that? That means it's Breast Cancer Awareness Month. We unfortunately treat a lot of, or maybe fortunately, depends on how you look at it. We treat a lot of breast cancer and we prevent often breast cancer because we balance hormones. But I want to go over something with you. And yes, I'm wearing my pink for Breast Cancer Awareness Month. But I want to go over something with you about hormones, hormonal balance, and something we've been talking about for a long, long time. And that is how to detoxify your bad estrogens and what to look for and who is at risk for breast cancer and ovarian cancer, because they're very tied. But I wanted to show you something here, and that's why I'm kind of moving. This is my wall of some of my newsletters, and I want to show you something particularly because I want to tell you about how long I've been talking about this. Years. So this is a newsletter from 2014, okay? It's my winter newsletter. And I have a lot of information on my newsletters, and my patients get these emailed to them, and they're hard copy published, etc. But I just want to show you this. I wrote an article here about bad estrogens and negative effects with estrogens in 2014. It was a study, okay, that was actually a Harvard-based study. And here we are in 2000, almost 20, and still talking about it. And unfortunately, I still see new cases in uninformed patients about breast cancer and ovarian cancer and the negative consequences of estrogen. Now, ironically, my article here I wrote in the spring of 14 and in 13 here, okay, were also about hormonal balance that has to do with the benefits of actually progesterone, how they can be breast cancer protective, and actually testosterone and how that can actually be breast cancer protective. But here's the key things that you want to look out for that you might be at risk. So not just in waiting and diligent watching with mammograms and maybe even infrared thermograms screening, but here's what you want to be aware of and share this with others and loved ones that might actually have this, especially if in their late 30s, okay, to early 50s, that's the spike of breast cancer, okay, and that's because that's when you're going to be at the most risk for what we call estrogen dominance. 90% of breast cancers are estrogen dominant fed, whether you have the genetics or not. Remember that. It's hormonally driven 90% of the time. And the two common things that we see here at Longevity Health Institute, always when somebody has cancer, bad stress levels, bad mind-body connection, they live a high-stress life, and bad diet and bad gut. Okay, that's your immune system, 70% of the immune system. So if you have digestive issues and high stress, that's not a good combo. And when you're in that window of estrogen dominance, you gotta be preventative and do something about it. But here's also the other risks. If you have fibroids, if you've had ovarian cysts or been diagnosed with PCOS, okay? If you're overweight, if you have fatty liver or you've been told you have high liver enzymes, these are people that need to be extra diligent about screening for breast cancer, doing mammograms, thermograms, seeing a functional medicine doctor like myself or my practitioners, and evaluating their hormones in detail and make sure that they get out of estrogen dominance, and at least that they detoxify their estrogens appropriately, which has to do with liver function. There's some things that actually can help you detoxify your liver. On our website and in our supplement shop, we actually have products that actually help detoxification and help literally mitigate risk to estrogen dominance. One of them is called Estroblock, made through Delgado Protocol. Dr. Delgado, Nick Delgado, great physician, PhD, and doctor, doctor, PhD, not a physician, not a clinician, sorry. But Dr. Delgado's product, Estroblock, actually it has cruciferous vegetables, DIM and IC3, that actually help your liver get rid of bad negative estrogens. Liver detoxification products that we have on our website actually help you clear and methylate, get rid of bad estrogens. Omega-3s help you get rid of bad estrogens. Weight loss, high intensity exercise, fat loss, low sugar, getting out of insulin resistance and treating prediabetes or type 2 diabetes. these are the things that help you clear bad estrogens. But first, you got to be evaluated. So, hope this informs you in the start of Breast Cancer Awareness Month, October here. Wearing my pink, always looking out for my patients, female and male. Okay, it does happen in men. I don't see many breast cancers in men, but it does happen, believe it or not, because of the same thing, estrogen dominance. So be aware, be informed, get checked out, okay? My practitioners, myself, are happy to help out. You can also go to our supplement shop on our website, longevityhealthinstitute.inc, and go to our supplement shop. The password for our supplements is health to get access there. They're all high quality, certified GMP, physician medical grade products, and they will do you very well to help mitigate any of these imbalances in estrogen dominance, okay? Typically, we like to use our liver cleanses, our ester block, some omega-3s, and anything that's going to help you get out of higher sugars and help you with weight loss. So hopefully that educates you. First, get evaluated. This is Longevity Health Institute, Dr. Lewerenz. Be well.